Thank you. Okay, so our group is Harvest Sozo Surgical and Medical Outreach. We're affiliated with Harvest Sozo Intercontinental Ministries Unlimited, which is a church organization that is spread throughout the United States, throughout Africa, and around the world. So a little bit about us. Our mission is to improve the health, wellness, and quality of life by providing access to healthcare in underserved and vulnerable populations in those communities around the world. We're formerly known as Bethel World Outreach Ministries. We recently underwent a name change. We're a 501c3 organization with NGO status. So we make arrangements for our volunteers upon arrival to our international destination. That includes transportation, meals, permits, clinical logistics, and we assist as much as we can with lodging. We secure equipment, supplies, and medicines from the United States through partnerships. Those might be pharmaceutical companies, medical supply companies, hospitals, and other NGOs. We get those supplies before we leave, so we show up with Liberia with the equipment we need. So why Liberia and Sierra Leone, or if you're Liberian, Sierra Leone? Within these countries, you have limited access to healthcare services, whether that be because people live in a rural area, which is what we call the interior, where they're unable to travel to get to a hospital or a clinic. Limitations with infrastructure, whether that's the roads, availability of healthcare professionals, or just a lack of medical facilities in general. There's also issues with infectious disease outbreaks. People are mostly familiar with the Ebola outbreak that happened a few years back, and then the COVID-19 pandemic that affected the entire globe. So those outbreaks have strained the healthcare systems and furthered the limitations to resources and access to population health and good healthcare. Maternal and child health. So Liberia and Sierra Leone have extremely high maternal mortality rates. Children suffer from malnutrition, and then the mothers have a lack of access to prenatal and postnatal care. Health education, there's limited literacy in general within Liberia and Sierra Leone, and that leads to limited health education and awareness. So there's a lack of knowledge of how to prevent communicable diseases. There are also economic factors such as poverty and economic disparities, inadequate infrastructure, which we spoke about before, the roads, and living in remote areas, and then human resources for health. So healthcare professionals, there's a shortage of doctors, nurses, and other healthcare workers. Likewise, with the occurrence of these pandemics and spread of infectious disease, you have healthcare workers that are overworked. There's also limited preventive care, vaccinations, healthcare screenings that are available to the people who live in these areas. Water and sanitation is also an issue. So lack of clean water and sanitation facilities is going to lead to waterborne diseases. And then post-conflict challenges. So as many people in this chat know, or this group know, Liberia experienced a prolonged civil war that had lasting effects on the healthcare system. So rebuilding and strengthening the healthcare infrastructure is an ongoing challenge that we all have to partner up to tackle. So our first trip was in 2019 in November. We traveled to Liberia. We donated 114 hospital beds to the John F. Kennedy Hospital. We performed free major and minor surgeries. So in this picture, that's one of our general surgeons on the left, Dr. Peel. He's doing surgery with a resident from the Dogliati Medical School, which is affiliated with JFK. The sites we operated out of were John F. Kennedy Medical Center, ELWA, and the Darlingston G. Johnson Medical Center, which is a clinic that is hosted by our organization, Harvest. So we were able to perform 84 surgeries, and we saw over 1,000 patients in 2019. Shortly after, of course, the pandemic hit and we were unable to travel. However, it was good to hear that the 114 hospital beds that we donated to JFK was able to house more patients when the pandemic hit. Likewise, in 2022, after collecting PPE while the pandemic was going on, we were able to travel to Liberia and Sierra Leone and deliver the PPE we collected. So gloves and other medical supplies. Those were donated to the Connaught Hospital in Sierra Leone, the JFK Hospital in Liberia, ELWA in Liberia, 14 Military Hospital, and the Darlingston G. Johnson Clinic. So on the right, you see that we are opening the 40-foot containers containing the medical supplies, and we're giving them to the people who work in Liberia. So this man in the purple right here is actually Dr. Jerry Brown. People might recognize him, you might not recognize him. He was the Person of the Year for Time Magazine. He was one of the Ebola fighters. So he came up with the vaccine cocktail that helped people to recover from Ebola. So in February 2023, we also traveled back to Liberia. We went to John F. Kennedy and Redemption Hospital and the Darlingston G. Johnson Clinic. So you're going to see that we're working with the same places every time, because our goal is to foster longevity. So we're not just trying to go and do a quick mission trip and feel good and leave things at that. We discuss with these hospitals and clinics throughout the year what their needs are, and that's what we try to bridge the gap on when we return. So at the clinic alone, we served 770 medical patients. We saw 76 eye surgery patients, and that was done through partnering with the eye group that was there. And then we added another institution called the Grace Healthcare Center, who they also saw 751 patients. So we were able to triple our impact while there. Again, we perform free major and minor surgeries. At the top right, you see our general surgeons, Dr. Alfred Shaw and Dr. Peel. And then at the bottom right picture, that's our work in the clinic. So people are getting their blood pressure done. They're getting, it's like our pre-screening area before people check in and go in to see the doctors. We performed 3 times more surgical procedures than we did in our trip in 2019. 88 surgeries were done at JFK, 176 surgeries were done at Redemption, for a total of 264 surgeries performed. So the 176 surgeries at Redemption and 88 at JFK is important, because not only do we partner with these institutions, we work together. So their surgeons come out and they help us during our trip, and we help to reduce the healthcare burden while we're there. One of our main focuses is capacity building. So we donate medical supplies. We talked about the hospital beds, but we also keep a running list of the items that these institutions need to operate and function properly throughout the year. And that's what we search for during our downtime before we return back from our trip, back from the United States. So in the top right, you're going to see those are the hospital beds that were donated to JFK. So they've been able to open up entire wards with the beds that we donated. And when we travel back and work with JFK, these are the areas that our patients stay in before they are receiving their surgeries. And then they also return here for their recovery. So we're not impeding on the functioning of the hospital. We're actually increasing their capacity and working alongside with them. At the bottom right is a bus that was donated by Senator Sar Joseph, who is the senator of Montserrado County, which is one of the biggest counties in Liberia. He heard about our trip and decided to get involved. So that opened the door for our ability to transport our patients to wherever location they needed. So we had the Grace Healthcare Center, which helped patients who were in that area, and then the Darlingston G. Johnson Medical Center. If for whatever reason Darlingston G. Johnson was overwhelmed and Grace Healthcare Center could use people, we were able to transport people using that bus. So our present upcoming is our March 2024 trip. We're going to Freetown, Sierra Leone, and then Monrovia, Liberia. We plan on arriving on March 7th, 2024, which means we're leaving on the 6th. Our outreach will be from the 11th to the 15th at the Connaught Hospital, which is the major hospital in Sierra Leone. And then our outreach in Liberia is going to be from the 18th to the 26th. So that we're going to be operating mostly out of the JFK Hospital and Redemption Hospital for surgeries, and then the Darlingston G. Johnson Clinic for standard medical procedures. That clinic has a maternity ward. They have a pharmacy, which we make sure is stocked when we get there. And then on the top right, you'll see the three people on the left are our social members of our social work team. They live in Liberia, and then Pastor Nip is on the right. And then down here is our pharmacist. She is going to be joining us later on. Volunteer information. So there are several ways that you can get involved. You can travel with us for our upcoming trips. That would require just some travel documentation, vaccinations, which I will get into later. But you don't have to be a medical professional to travel. We can put you with our social work team. Our pharmacist usually trains people, so you would be working as a pharmacy technician. And then if you are a pre-medical student, it's a good experience because you can shadow the surgeries and get to know the doctors and potentially build a relationship. We try to fill in the gaps where we can. We remember that we had issues with podiatry and dentistry, which is why Dr. Fabian and Dr. Tara, it's wonderful to have you on board. You can also fundraise or donate. So we will need help when it comes to fundraising. We have to purchase the medical supplies that we are taking with us. We also you as a volunteer can fundraise if you plan on traveling as well. We'll get into that at our next meeting. Research and data analytics. So when we go on these trips, we keep a database of the patients that we see, the cases that we see, so that we can understand what the needs are for the next time that we return. We're hoping to foster a relationship with Robert Wood Johnson, the hospital and the medical school, so that we can start some research projects and some research publications. So if that's what you're passionate about, that is open to you. We saw that there was a need for patient education because our last trip, for example, we saw that there was a strong prevalence of HIV and hepatitis B within the community that we were working in. So doing the research will help us come up with sustainable solutions on targeting these problems. Flight coverage. So if you are a doctor, advanced practicing nurse, or a physician assistant, we have a grant program that will ensure a free flight for you. And then for volunteer coverage, I think we said it before, but once you are in these countries, we cover your food and ground transportation, and then we help out with the lodging. For the flights, it's important to let us know ahead of time if you plan on traveling with us, because then we can apply for group rates, and we would all meet at the same airport and fly out together. So here are just some pictures. The top right is, or the top pictures is us as a team with the chief medical officer at Redemption Hospital. And then on the bottom is our team at Grace Healthcare Center. So here's a volunteer checklist. I'll be going through this more extensively with you as you get more involved with the trip, but you would confirm your participation if you are traveling or if you're supporting. So if you are traveling, we'll review the mission information with you, obtain necessary travel documents, for example, checking your passport. We all know the wait times are longer right now, so you would need to renew your passport if it's necessary. And then we would begin the process of obtaining a Liberian visa. All of that information we'll continue talking about in the WhatsApp group chat. Medical clearance and vaccinations. So a yellow fever vaccine is recommended, and the malaria prophylaxis, which is just going to be tablets that you would take before you leave and then while you're there, and then you'll finish them once you get back. Fundraising and donations, we have a GoFundMe. Volunteers are free to fundraise on your own behalf if you need it. Otherwise, the fundraising efforts will go towards obtaining the medical supplies and the drugs. You'll attend a pre-departure meeting where we'll orient you to where we're meeting, where we're flying out, what your expectations are, how much downtime, and we'll have continuous meetings while we're in these countries. Packing the essentials, which is your clothing, probably scrubs, some nice outfits to walk around, sunscreen well, everyone should use sunscreen. So sunscreen, things like that. So we'll give you a list of things to pack. Obtaining suitcases. So we ask that each volunteer carries at least one suitcase. Sometimes we are able to ship over 40-foot containers with the medical supplies that we'll need, but we also like to travel with the suitcase so we have the things that we need with us at the time of arrival. And then emergency contacts for you in the case anything were to happen. We'd rather have the contacts and not need them than need them and not have them. And then we'd also need proof of licensure. So if you are a practicing provider, we'll need a proof of license to submit to the medical facilities there so that you have that you are licensed to practice within the country. If you are a medical student, you can provide proof of school enrollment. Medical students are able to do patient interviews under the supervision of a resident or attending while you're there. Okay, so our future, our big aim is sustainability. We already target that through the clinic that runs throughout the entire year, but we're hoping to come up with new ideas to make our project more long-lasting. Patient education, the bottom left picture here. During our outreach endeavors, we had a nurse practitioner who came in and she gave a presentation on breast cancer screening, the anatomy, and teaching women how to search for lumps. These are things that we hope to continue to implement so that we can increase the health literacy within the countries that we're visiting. And she is actually a librarian, so she does these regular health education trainings and meetings while we're in the US planning for our next trip. Advocacy through policy, as we said before. In the middle is Senator Sar Joseph. This is us in his office. By continuously showing an interest in Liberia and the Liberian people, there are leaders within the country who are willing to support our cause, and that can lead into advocacy for better roads, better conditions for the hospital, etc. Research, so HIV, STIs, other communicable disease. We'd like to do research so that we understand what the major concerns are in these countries, and we're not just going there to feel good and leaving with the burden of the healthcare system remaining on the people who are there. So we're trying to do research, figure out what the main problems are, what the things we can change are, and being very targeted in our approach. Medical education, which we spoke about already, and capacity building. And then within capacity building, as you heard, we have an engineering student. So another aspect that we would like to explore in the future is medical facility designs. So figuring out ways to improve the setup of these clinics and hospitals so that when people come, they are taken care of in a way that speaks to their humanity. For example, our last trip, we made sure that as the patients were waiting, since we didn't have enough capacity to hold everyone within the building, we made sure that we had a tent up and the patients were seated. Because the last thing you would want to do is have a patient come in for a different reason and then pass out from heat stroke while waiting for medical attention. Collaboration and partnership, which is what we try to keep ongoing with the medical facilities that we work with, and innovation and technology. So we're hoping to bring in more supplies. If you look to the bottom right picture, they still use paper, which, I mean, everyone doesn't have to use a computer, but when it comes to keeping patient file and information, having a database and having like a hard drive that you can store these things on is more secure and more accessible than paper records. So we talked about why Liberia and Sierra Leone, and we talked about the limit to access to healthcare and the other situations that they're facing. And here is our list of what we've been doing to try to combat that. Water and sanitation is something we haven't yet explored, but maybe that's something that you as a volunteer or a member of our team can help us to work out in the future. These are all a result of many different things, but these are post-conflict challenges that the Liberian and Sierra Leonean people still face. Okay, Micaiah, you can stop the recording, and now we're going to go into the Q&A mode.